Hi! Today, the students of the Tucson CHC are presenting the research project on the effect of colorectal cancer education on compliance of fecal occult blood testing among El Rio Community Health Center patients.
Here is our completed poster, which we will now discuss in further detail. Colorectal cancer is one of the most deadly types of cancer with high noncompliance rates of screening. At El Rio Community Health Center in Tucson, there are measures in place to identify patients eligible for colorectal cancer screening, as well as providing these patients with the screenings. Despite attempts to eliminate barriers to care, such as cost of screening, there is still a high noncompliance rate of follow-through for colorectal cancer screening. The baseline El Rio completion rate for colorectal cancer screening was 22.9% in the second quarter of 2015. The goal of our study was to evaluate the effectiveness of patient education regarding colorectal cancer and the use of fecal occult blood testing on screening completion rates. We also set out to identify barriers preventing patients from completing FOBT screening.
Participants in the study were El Rio patients who had regular appointments between February 18th and March 31st, who had not completed colorectal cancer screening and were between the ages of 50 and 75. The following steps were performed during every encounter after the patient agreed to participate in the study. First, a pre-education survey was administered. Then, education was delivered by a medical student or by a medical student and community health advisor team. Colorectal cancer screening basic fact sheet from the CDC was used as an educational aid. After this, a post-education survey was administered, which included the same questions as the pre-education survey. Then, the patient was given the FOBT kit in the room and was given instructions on how to perform the test at home. A phone call to follow up was made 2 weeks later to assess potential barriers to completion. The data was collected from surveys and completion rates and was analyzed using McNemer's test, logistic regression, and Spearman correlation.
Moving on to the results from our study. Figure 1 demonstrates that 120 CHC patients met the inclusion criteria and were invited to participate in the study. 41 patients agreed to participate in the study, with a 34.2% participation rate. And 100% of those completed pre- and post-education. 48% completed the follow-up survey, and of those participants, 60% completed FOBT screening. Of those that completed the screening, 17% of the screens were positive and 67% were negative results. 51% of the study participants could not be reached for the follow-up survey, and 29% of those participants completed FOBT screening. 42% of those screens were negative. The combined completion rate for FOBT screening was 44%, which was significant, with a p-value equal to 0.001, compared to the baseline El Rio screening rate of 22.9%, taken from the 2015 second quarter results. Table 1 shows the demographic breakdown of our sample in comparison with that of the El Rio CHC. The majority of both populations identified as Latino Hispanic American. There was no significant difference in the distribution of the two samples.
The overall probability of answering correctly on the post-education test was 0.94, which is significantly greater than the pre-education probability of 0.86, and this is with a p-value less than 0.001. Specifically, the probability of answering correctly questions number 1, 3, 5, 6, 9, and 11 on the post-test were found to be significantly greater than the pre-test, and this is shown in Table 2. There were no significant associations found between the post-education compliance likelihood response and the actual compliance. There was a significant association found among demographics and compliance among non-Hispanic white or Euro-American, and for other, including Black or African American and Native American or Alaskan Native, were 27% and 0% respectively, while compliance among Latino Hispanic Americans was 58%.
Figure 2 and Figure 3 demonstrate the reasons participants did or did not complete FOBT screening. Figure 2, on the left, demonstrates the main reasons the participants completed the FOBT screening. As you can see in red, the main reason for completing the screening was concern for their health. However, we were unable to reach 6 participants to get their reasoning. Figure 3 on the right demonstrates the main reasons participants did not complete FOBT screening. As you see in blue, the main reason for not completing the screening was being too busy. However, again, we were unable to reach 16 participants to get their answers.
Now to move on to the discussion and summary. We will start off by discussing some limitations of the research. Inclusion of an I don't know option, as well as more variety in the true-false answers to the questions, may have influenced the estimate of the education's impact. There was variation in workflow between clinics, such as whether the entire patient encounter was performed in the exam room. Another point was that physicians referred patients to colonoscopy instead of FOBT screening, and this could have limited the size and diversity of our sample, therefore limiting the generalization of these results to a larger population. Next, there may be inherent differences between the baseline LRIO completion rate of 22.9% and the population studied. And lastly, selection bias should also be acknowledged as the result of patients given the option to self-select into the study.
In conclusion, this study showed improved patient knowledge of colorectal cancer and screening, as well as increased FOBT completion rates from a simple intervention. This education tool could be easily administered by medical assistants at El Rio and other CHCs. We assessed barriers to completing screening during a follow-up phone call. Main barriers patients reported were time restraints, busy, or pressing medical problems to resolve. Future research may assess cultural barriers to completing colorectal cancer screening, as well as the efficacy of the educational model at improving colonoscopy screening and FOBT compliance rates over subsequent years. The study's findings will be presented to the El Rio CHC board.
We would like to thank Dr. Joy Lewis, Dr. Ray Wagner, Dr. Chris Dixon, Kate Willahan, Dr. Doug Spegman, and the El Rio CHC for their support throughout this project. We would also like to thank the patients who participated in this study for their time and contribution to the research. Here are the references used throughout this study. Thank you for your attention.